Hi, Dr. Staci Avakian with Back Pain Relief Center in Vineland. We're here with Terry today. He's got some low back pain. He's been having a little bit of an episode. It's been acting up for the past week or so. So he is feeling improved, but he's still having a lot of stiffness. So we're going to go ahead and do an adjustment and try and relax some of the muscles that are pretty tight and spasm back here. So just let me know if anything's too much. So that just helps to kind of loosen the muscles and get some blood circulation going. This will help introduce some motion into the area. Not quite as tight up top as you were. A little bit. That's a little worse. Any pain with that?
Left side.
Left side?
Mm-hmm. Oh, right there. Mm-hmm.
Put your right hand on your low back. And switch sides. Hands. And back down. Right hand on your low back again. And switch hands. And both hands. Good, back down. So this is just an analysis I do so that I know pain.
Nope.
Oh, good. Still good?
Yeah.
Good all the way?
Mm-hmm.
Hurting your quads?
A little bit. Good stretch.
Still good?
Yeah.
Good. Nice breath when you're ready. So right now I'm just checking for some ribs. And one more time. Everything's up here, okay?
Uh-huh.
Is this okay?
Yeah.
Keep breathing. So I hit a trigger point, which can be a little bit tender, but once you have a little bit of sustained pressure, it starts to release. And that's just a muscle spasm, a muscle that's knotted up. All right, so that's Terry's adjustment for today. And Dr. Staci Avakian, Back Pain Relief Center in Vineland.